And so at Securi, that's one of the things we do is we are execution specialists. We have teams of people that are set up to solve these problems and get past those roadblocks. And we recognized that years ago that you need to have teams of people dedicated to execution so you can get those consistent results. So process execution, that's really the first pillar that we stand on for differentiation. The second one is for disaster recovery. Now, disaster recovery entails backup and it entails the recovery of data. So for an outpatient healthcare clinic, this is absolutely critical for multiple reasons. One is every clinic has a bunch of providers. Every provider probably has 3 to 4 staff members that are assisting them. When a provider can't see patients, it's not just that one person. It's magnified 3, 4, 5 times the cost. So now you have all these staff members doing nothing, and you're not generating that revenue. So in a disaster, it gets really, really expensive really fast. And is that disaster an hour? Is it a day? Is it weeks? Like, you can't have a practice that doesn't see patients for weeks. Or even worse, you did see patients and now you have paper notes that you're trying to get caught up on, right? Like, no one wants that. That's how you lose great staff members. So ultimately, Securi recognized this, that in outpatient healthcare, we needed to be at a place where we had a bulletproof disaster recovery solution to prevent that scenario. We wanted to get customers back up and running as fast as possible. That's just, for everybody's business, they want that. But in healthcare, you have to meet HIPAA guidelines. And so we've designed our backup and disaster recovery solutions around HIPAA guidelines. And so in our situation, we provide disaster recovery. If you have a piece of equipment fail in your office, we can turn it back on. We've got a backup. We have disaster recovery. If you lose data, we can restore that and get you back up and running. We have disaster recovery if you lose your building. And so, or even if you have a regional disaster. And HIPAA mandates all of these levels of disaster recovery. So let's say you're in the Seattle market and you have a massive earthquake and you can't get into work. Well, are you not going to serve your patients? What happens if you have that diabetic that needs to have their medication monitored? What happens if you have someone who needs a prescription refill? So what we can do is we can actually turn on your whole computer system in a cloud data center, which is far, far away from wherever the disaster was. And now you can have your team who's working from home, remote into that cloud-based disaster system, and they can work. I mean, it's not going to be as fast as in the clinic, and they may have a bunch of backlog, but they're going to be able to work, and your patients are going to be able to get taken care of, and you get to check off HIPAA guidelines for that. So we recognize that early on when working with outpatient healthcare.